Hello class, this is week 3 of Abnormal Psychology, and this week we're going over the topic of clinical assessments, diagnoses, and treatment. So assessments are the clinical tests that we can use to determine if a patient is suffering from some sort of abnormality in thinking or behavior, so that we can use those tests in order to diagnose properly if we suspect that the patient is suffering from depression, an anxiety disorder, a mood disorder. Then we can use a variety of assessment tools to be able to see if that is the, in fact, correct diagnosis to give a patient. And treatment, of course, is related to the diagnosis. Once a patient has a diagnosis, then we can decide what tools we can use to treat that diagnosis effectively. You have a discussion this week, again, between Tuesday and Thursday, that's talking about the issues of psychological diagnoses. And is it valuable to have a diagnosis? What are the potential pitfalls of diagnosis? Are there any negatives to saying that, yes, indeed, you do in fact have bipolar disorder? Or you do in fact have borderline personality disorder? Are there any negatives for the patient when receiving that diagnosis? And also consider, we can give these medical diagnoses very easily in our culture. If someone has type 1 diabetes or type 2 diabetes, we immediately take that as fact and we understand it. It's coming from a purely body medical point of view, and there's medications to go along with it. We're all very familiar and comfortable, and it's very well respected. However, psychological diagnoses tend not to have the same level of cultural value. And so that's something I would like you to discuss in your collaborative learning assignment in your groups this week. And you do have new groups. You're going to have new groups for your collaborative learning discussions every 2 weeks. So every 2 weeks, you'll get a new group of students within your class to discuss these topics with. To be useful, clinical assessment tools need to be both reliable and valid. Reliability refers to the consistency of the assessment measures. So the test should lead to the same results every time when given in the same environment. There are 2 different types of reliability. The first is test retest, and that means that every time you give the test to the same person, you're getting a similar result. So giving the assessment to the patient one time, get the result, and then maybe at a session a month later, you still get the similar result if there hasn't been any significant clinical intervention. There's also inter-rater reliability, so if a given assessment should have a similar score between assessors. So different clinicians should lead to the same scoring on a patient if the test is reliable in terms of the assessors. Validity refers to the accuracy of a test result. A good assessment tool must accurately measure what it is intended to measure. And there are 3 specific types of validity. There is face validity, which is when an assessment tool appears to measure what it's supposed to measure, but this does not necessarily indicate true validity. So it's the face value of the assessment. Predictive validity is when a tool accurately predicts future characteristics of a behavior. So this is highly valuable as a diagnostic if your assessment tool has predictive validity. Concurrent validity is when an assessment results agree with independent measures assessing similar characteristics of behavior. So usually as a clinician, you're going to use multiple assessments to measure thinking and behavior to result in your diagnosis. So concurrent validity will mean that one assessment is in agreement with your other assessments as far as what you're intending to measure for a particular diagnosis. So now I'm going to go over a few of the assessment tools that clinical psychologists use. These tools can be used in conjunction with one another. One assessment tool is typically not used in and of itself to make a diagnosis. You can combine them together to figure out what exactly is going on with the patient. So first I'm going to go over projective assessment tools. I'm going to go over the Rorschach test, which you are probably familiar with. This is when you're presented with ink blots and you're told just to say what you see in the ink blots. The other is the thematic apperception test, which is when the patient is shown an image. Usually it's of a very ambiguous situation between one or two people, and the clinician asks the patient to make up a story about what's going on. So there's a few clips here in this video to fully illustrate what those tests look like.
Well, hi, Ashley. It's nice to see you again. How are you doing today?
Hi, pretty good.
All right. Well, I just want to explain what we're going to do today. This is a measure of imagination, one form of intelligence. I'm going to show you some pictures one at a time, and your task will be to make up as dramatic a story as possible for each picture. Tell me what has led up to the event shown in the picture, describe what is happening at the moment, what the characters are feeling and thinking, and then give the outcome. Speak your thoughts as they come to your mind. Do you understand?
Could you just tell me again what I have to include?
Oh, sure, absolutely. What you want to do for each card is tell me the current situation, the thoughts and feelings of the characters, the preceding events, and then the outcome. Any other questions?
I don't think so.
All right. Well, since you have 50 minutes for 10 pictures, you can devote about 5 minutes to each story. Here's the first picture.
Okay, so now I just tell you?
Yep.
Okay. Well, he is studying right now for a test, and he's feeling frustrated and bored.
Okay. What led up to it?
Well, he decided that he was going to trick his parents into pretending that he was sick, but in reality, he wanted to miss school because he wasn't prepared for the English test that they were going to have that day. So he lied to his parents and he decided to stay home and study. And he's really concentrated right now because he only has this one day. He knows he's going to have to make it up tomorrow. And he looks like he's in deep concentration. But I'm also going to say I think he's frustrated too because the way that his hands are.
So projective tests are helpful for providing supplementary information to the clinician. However, they have not consistently demonstrated reliability or validity, and they may be biased in terms of what the sample population is. So it's been shown that there are cultural differences in the interpretation of these projective tests, and we need to be more culturally sensitive rather than making diagnoses based off of our expectations of what the interpretation of these images should be. And that's something we should be aware of throughout all of these clinician tests, these clinical assessments, is that often culture is not taken into account in terms of what is the standard, what is the normal expected outcome. You know, that could vary culture to culture. Another clinical assessment tool are personality inventories. Personality inventories are usually self-response, multiple choice responses. These tests are designed to measure broad personality traits, such as how introverted someone is, if they have any tendencies toward depression or hypomania, schizophrenia, borderline personality. They can even look at tendency towards psychopathic or deviant behaviors. So a lot of different scales come out of these types of assessments of personality. The most widely used personality inventory is the Minnesota Multiphasic Personality Inventory, otherwise known as MMPI. The MMPI consists of more than 500 self-statements describing physical concerns, moods, behavior, sexual behavior, and social activities that can be answered either true, false, or cannot say. So it makes it a very simple, quick way. I mean, there's a 500 self-statement, so you need to have quick responses, true, false, or I cannot say. It makes it pretty quick for the subject to get through 500 self-statements. And then, of course, you get a lot of different clinical scales out of that to look, okay, is this someone suffering from depression, anxiety, or maybe they're subthreshold on a lot of different things, and maybe they have an extremely extroverted personality or extremely introverted. They also show clinical scale of masculine versus feminine traits, which could be debatable in terms of what is true masculine or feminine. That's probably going to vary for culture. So again, we need to be critical of these assessments. And here is an image showing the graph of how someone may look after taking the MMPI on all these different clinical scales. One line is showing the pre-treatment, and the other line is showing the post-treatment to give you an idea of what a clinical profile will look like after taking a personality inventory. So personality assessments are widely used, and they can be effective in getting more information about your patient. However, they do have some limitations. One of the limitations is that, do we know for sure that we are in fact measuring what we are intending to measure? So that's the validity. It has been called into question whether the MMPI is truly valid. When we're doing assessments on masculine femininity, introversion, extroversion, are we asking things that are truly going to get at what we're intending to get at? However, these personality inventories are very quick and cheap to administer relative to the projective studies. They're really easy to get at a statistical output. As you saw, that graph was a very nice way to measure clinical improvement. So that's excellent. It also has really great reliability. So between raters across different clinics, different time points, you're going to get similar scores, and you're going to get changes in scores if you provide treatment. So good tools, but again, we have to be critical of the assessments we're using and really ask questions about both reliability and validity. All right, students, that wraps up your video this week for clinical assessment, diagnosis, and treatment. Be sure to give great feedback in your clinical assessment collaborative learning assignment this week, your discussion. You're already in your groups. You have new groups this week, so be sure to give them all great feedback, great insight. And be sure to write succinct, clear, accurate posts. I really appreciate when students can give examples that are novel, that are not just writing directly from the text or the module. They can really be insightful about their own experiences and apply it in a new way, really synthesize the information and apply it to your own life. I'm really enjoying the post, so keep it up, guys. Also, you have a quiz this Thursday. Study up your module, study up on your textbook, and I'm sure you guys will just do as well as you did last week, which was pretty great. All right, guys, take care.